What are the most common types of shoulder injuries that you see?
I think with shoulder injuries, there's a lot of confusion in terminology, and to keep it simple, we can talk about bursitis and rotator cuff problems. Bursitis simply is the lining of the rotator cuff. That's severe pain that can be from overuse activities, and it gets very inflamed and it's painful, limited range of motion. Very commonly it's weak. If that inflammation continues over time, or if there is a significant injury in terms of lifting or an injury to the shoulder with sports or accidents, you can actually tear the tendon and then you have a rotator cuff tear. Very similar in terms of pain and overall symptoms. Bursitis we can commonly take care of without surgery, simply a cortisone injection or some exercises. Rotator cuff tears do very well with repair. Unfortunately, they don't heal without surgery. We're recognizing that more and more, and we have the advantage and the capability of being able to repair those now arthroscopically.
And tell me about some of the minimally invasive arthroscopic procedures you're doing now.
My emphasis is on shoulder arthroscopy, and it really is turned around how we treat rotator cuff tears, and we're recognizing that rotator cuff tears, certainly traumatic ones, meaning from a specific injury, should be fixed immediately. The recovery is accelerated, their overall outcome is superior, and you can do that because it's arthroscopic. Now what that actually means is we say stab incisions. The incision or the instrument is approximately the diameter of a number 2 pencil. And we can place those through tissue, through little stab incisions, and we can avoid the large incisions through the muscle, through the skin, and all those pain receptors, and dramatically reduce pain level and allow the patients to move quicker after surgery.
So you're able to perform the surgery with a minimal amount of anesthesia?
Anesthesia is required. But the benefit is that you're not increasing the morbidity of the surgery in terms of long incisions through muscle and through skin and other tissues. So anesthesia is similar. We do also do regional anesthesia in addition to general anesthesia, and that's where they actually numb up the nerves around the shoulder, and that helps with pain post-operatively. But these patients do go to sleep. They do go home the same day, and which is quicker than traditional open shoulder surgery, and it does accelerate the recovery.
You're doing some really new things with hip arthroscopy. Tell us about that.
There's been, you think we've discovered everything in medicine, but that's not true. And even in orthopedics and specifically arthroscopic surgery, we're continuing to push the boundaries and finding new entities and conditions to treat. 2 examples are in the elbow and in the hip. The elbow, we've been doing arthroscopic surgery for basic conditions such as loose bodies. If there's fragments in the joint, you can take out. Somewhat limited, uncommon conditions, but they do very well. But we're also finding a need for tennis elbow or tendinitis of the elbow, which is extremely common. We are treating that through an arthroscopic approach, little stab incisions again, instead of the open surgery. And we've had the short-term results are very good, and again, a quicker recovery with arthroscopic surgery. In terms of the hip, there's even more exciting, newer information for some hip conditions that we're increasingly recognizing, called femoroacetabular impingement. It's basically some impingement in the hip joint that leads to early arthritis. We understand now that we can actually treat this arthroscopically in the hip with dramatic improvement in pain and recovery while avoiding any type of open surgery in the hip. And this can be done for pre-arthritic conditions and this impingement and tears that athletes can get and this impingement in the hip.
Generally speaking, do you see most of your cases sports related, or as a result of arthritis or aging or injury, or how does it break down?
That's a great question. I'm trained to treat the athlete in sports medicine, and in that training we really learn that the goal in terms of treating an athlete is getting them back to their avocation or their sport as quickly as possible. So that really applies to workman's compensation, It applies to the weekend warrior who wants to get back to activities. So that can be applied across the board, and we do that. So I have a lot of athletes. I have a lot of older patients who are very active. And in terms of what type of injury, a lot of it's overuse injuries, but also probably less than half, but close to half is actually traumatic injuries where you tear the tendon. But not uncommonly, if you look at middle-aged to older-aged patients who have traumatic tears, commonly or very frequently there is some degeneration prior to that tendon's been intrinsically weakened. And then you have a traumatic tear. It's kind of acute on chronic.